slow things down, but we want to do another task. Okay.
This module covers Emergency Medical Care Guidelines from the Incident Response Pocket Guide, or IRPG. All firefighters, regardless of their level of medical training, must be familiar with these guidelines. They are a succinct reference for emergency medical situations within the wildland fire environment. Additional information on the IRPG, Emergency Medical Care section, such as Patient Assessment and Medical Incident Report, or MIR, should be referenced as needed. As a medical responder, your first responsibility is to provide for your own safety. Only provide medical care which you are trained and authorized to perform. Take accurate and legible notes. Record patient observations and medical treatments you administer. Use all personal protective equipment, or PPE, that you have available on scene to protect yourself. If you do not have PPE available and are not comfortable administering care without it, stop. Treatment principles. Prevent further injury by removing from danger. All firefighters must maintain situational awareness of hazards that are present in the wildland fire environment. Before you can provide quality patient care, you must first ensure the scene is safe. You are no good to your patient if you are also injured. It may be necessary to first move the patient to prevent further injury and for the safety of responders. Rapid assessment: airway, breathing, circulation, and life-threatening injuries. Conduct a rapid assessment to identify and correct or prevent immediate life threats to your patient. The rapid assessment involves checking life-threatening injuries, airway, breathing, and circulation. This process is critical to triaging the patient's status and developing a treatment and evacuation plan, and must be implemented in a thorough yet urgent manner. Control any major bleeding before proceeding with the ABCs. Airway. Is the patient's airway open or obstructed? An unresponsive patient's airway can easily be obstructed by a foreign object, body fluids, or a loss of muscle tone. Establish and protect your patient's airway. Manually remove obstructions. Drain fluids using the log roll and recovery position. Open the airway with the head tilt chin lift or jaw thrust maneuver. The airway is more important than a suspected spinal injury. If the patient cannot get air in, they die. Breathing. Look, listen, and feel for breathing. Do you see visible and equal chest rise and fall? If breathing is observed, is it normal or abnormal? For example, infrequent breaths, labored breathing, wheezing, shallow, etc. If your patient is not breathing, begin cardiopulmonary resuscitation, or CPR. Refer to CPR in the IRPG Emergency Medical Care section. Circulation. Are you still managing life-threatening bleeding? Are your treatments working? What do you observe when evaluating the patient's skin? Are they pale? Is their skin clammy, sweaty, or dry to the touch? If you have initiated CPR, continue until another rescuer takes over, you become too fatigued, or the scene becomes unsafe. Thorough exam. Look for method of injury. Check for deformities, contusions, abrasions, punctures, burns, tenderness, lacerations, or swelling. Conduct a thorough exam to better understand your patient's overall condition. If your patient is conscious, ask them pertinent questions: allergies, medications, events leading to the incident. Being mindful of patient privacy and dignity, expose the patient's body to perform a head-to-toe examination. Look and feel for any deformity, contusion, abrasion, puncture, burn, tenderness, laceration, or swelling. Closely watch for any signs of painful response which may indicate additional, less apparent injuries. Stabilize patient. Once you have established a baseline of your patient's condition, you must stabilize the patient. Provide environmental protections for patient, for example, shade, cooling, or warming. Recover after thorough exam. Place the patient in a position of comfort and proactively manage for shock. Specific treatments for injuries and illnesses are found in the IRPG Emergency Medical Care section. Transport decision: air or ground extraction. Does your patient require immediate medical transport? The transport decision should be made swiftly while considering all available options: agency vehicle, agency aircraft, ground ambulance, life flight, etc. Factors to consider when making a transport decision include: are there life-threatening injuries? What is the current and projected patient condition? Is the patient mobile? What is the projected transport time to definitive care by air and by ground? Are there environmental conditions that may impact medevac? Weather, fire activity, time of day, what resources are available on scene to aid with the medevac? Document all on-scene observations and treatment. Send with patient. When documenting a medical incident, legibly record all patient information and all treatments administered. If available, identify a dedicated scribe. This scribe may be you. The scribe may assist the medical IC in communicating with dispatch, incoming definitive care personnel, or the receiving hospital staff. Special consideration should be given to recording times of any treatment rendered, administered medications, placement of a tourniquet, patient's vitals, etc. Provide all documentation at the next level of medical care. Medical response procedures. All injuries must be reported to direct supervisor. All injuries must be reported to your direct supervisor no matter the severity, for example, poison oak exposure, sprains, strains, cuts, etc. Ego, pride, or fear of reprimand should not be a factor in communicating injuries. Even minor injuries may develop into severe injuries. Depending on the severity or complexity of the incident, you may contact your crew lead, division supervisor, incident commander, or dispatch. Follow the chain of command and predetermined incident response procedures. Reporting ensures proper documentation and may prevent out-of-pocket expenses for undocumented injuries. In case of medical emergency, contact incident supervisor or communications dispatcher using the Medical Incident Report on page 118. The Medical Incidents Report, or MIR, is a standardized form. The intent of the form is to establish control of the incident, whether routine or life-threatening, by initiating a new incident command system. Standardize a systematic process for reporting medical incidents or injuries similar to a fire size-up for initial attack. And enable any firefighter with prior training and direction to fill it out and transmit the information. The Medical Incident Report provides a succinct process of communicating both non-emergency and emergency information to dispatch or the respective medical personnel at the Incident Command Post, ICP. On an incident that is being managed by an IMT, the MIR will be included in the Incident Action Plan, IAP, within the Medical Plan, ICS 206, and will include standard operating procedures for communicating medical emergencies, contact information for nearest hospitals, burn centers, etc., communication plan including air-to-ground frequencies, etc. All firefighters, regardless of training, should know where this checklist is within the IRPG and how to use it. Medevac is an incident within an incident. One person needs to become the on-scene incident commander and transfer command later if necessary. The on-scene incident commander or medical IC takes control of the medical emergency in the same way in which the IC takes control of the wildfire incident. Depending on the complexity of the medical incident, the IC may identify specific incident needs and positions, such as a dedicated scribe, a primary medical provider, a squad to secure and move the patient, a SAW team to cut a helispot, a dedicated individual to speak on air-to-ground frequencies, etc. Any firefighter, regardless of experience level, may have to act as on-scene incident commander. Identify nature of incident, number injured, patient assessments, and location, geographic and GPS coordinates. Dispatch needs to know if the medical incident is an emergency or non-emergency event. You must objectively describe the scene and situation so that dispatch may activate the correct level of medical incident response. You must provide accurate GPS coordinates and geographic description to ensure an efficient response. Do not use patient names on the radio. Do not transmit personally identifiable information over the radio. Transmit only information that is pertinent to patient care. Determine transport plan. Limited visibility or darkness may delay or negate air transport. Identify and initiate multiple transport options: primary, alternate, contingency, and emergency. The wildland fire environment is dynamic. There is a constant struggle between the time wedge and viable operational tactics. There is a similar yet even more urgent balance when transporting patients to definitive care. Lives lie in this balance. Once an informed transport plan is made, execute it. The IRPG Emergency Medical Care Guidelines is a practical tool that is relevant to all firefighters. Familiarize yourself with the list prior to engaging in an actual medical incident to instill both confidence and competence in caring for one of our own.